Welcome to the channel Nursing in Handy. This channel is preferably for all the nursing fraternity to have a continuous learning. Today we will be seeing about restraints in children. So before proceeding into this topic, we must know why we have to apply the restraints in the children. So if as a nurses or the medical care professionals, if we have to do the examination of particular part of the babies, like if we want to examine their extremities, or if we want to examine their face or neck, we have to control their movement of any other parts like extremities. If we want to examine the head and neck, then we have to limit the activities of extremities. So in order to limit those activities, we are going to apply the restraints. So there are various types of restraints in children, like mummy restraints, jacket restraints, mitten restraints, finger restraints, extremities restraints. So all the restraints have their own pros and cons, and all the restraints have their own purposes. So we will be seeing about each and every restraint in detail and their purposes. And before applying the restraints, we have to follow one of the very crucial and important nursing ethical principle, that is non-maleficence and beneficence. So non-maleficence means we have not to do any harm to the patient by applying the restraints. Next is beneficence, means doing the benefit to the children. We will see one by one in detail. Restraints are protective measures to limit the movements. There can be short-term restraints to facilitate examination and minimize the child's discomfort during special test, procedure and specimen collections. Restraints can also be used for a longer period of time to maintain the child's safety and protection from injury. These are protective devices used to limit the physical activity of the client or a part of the body. Restraints are made up of linen, canvas, leather, plastic, metal or wood. So depending upon the conditions and also the circumstances, we have a different kinds of restraints based on their materials. So majority we used the restraints relating to the pediatric population, that is mummy restraints, jacket restraint, which is made up of a cotton material, and also we use a padded materials during the application of restraints. So we have to be very sure that while doing any specimen collections or during any procedures or any diagnostic procedures like cord side laboratory diagnosis, we have to apply the restraints depending upon the condition. Next is purposes: to avoid the clients from falling, to prevent the interruption of therapy, to prevent the confused or combative client from removing any life supportive equipment, to reduce the risk of injury to the or others. So for example, for some of the cases, like in life saving tubes are being connected to the pediatric populations. If that pediatric babies are using their extremities to remove those tubes, so in order to prevent that removal of that tube, we are applying the restraints to the extremities. In the same way, in some of the cases, like aggressively if the baby is behaving, we have to prevent the self harm and also harm to the medical care professionals, we are applying the restraints. And other reasons like avoiding the clients from falling, and if there is a need for doing a continuous therapy, in order to prevent the interruption in that therapy, we will be applying the restraints to the child. Next is some of the general principles for use of restraints. So appropriate, safe and comfortable restraints should be used. Restraints should be loose as possible. Tight restraints prevents the normal circulation. So we must, as a nurses, ensure that the tight is not too tight, that will interrupt their circulation. Next is sufficient padding must be used for extremities restraints to prevent the skin irritation. So while applying the claw hitch restraints and all, we have to see whether proper padding is being applied to the restraints in order to prevent the skin irritation. Restraint should be checked every 15 to 30 minutes, that is if there any skin laceration is there or not, any blister formation has occurred or not, like that we have to check periodically, that is up to every 2 hours we have to check for 15 to 30 minutes. Child's comfort and body alignment to be maintained. We have to be we have to ensure that the body alignment of the child is not being restricted due to the application of the restraint. Any required knots should be tied in a manner that permits the quick release. For example, we have to shift the patient from one ward to another. We have to make sure that those restraints are very easy to remove while these transportation of the patients, and proper documentation is required when restraint is used. So before application of any restraint, we have to obtain the informed consent from the caregivers and also the accent from the child. So we have to explain about the purpose of the restraint to the caregivers and do the proper documentation for the restraints. So restraints is also requires a informed consent from their parents or the caregivers before application. So because the restraints may cause sometimes the harm to the babies, like skin lacerations, if it is not applied properly. So in order to prevent those legal and ethical issues, we have to obtain the informed consent from the caregivers, as well as if the patient is school going children or adolescents, we have to get the accent from those children's. For that reasons, these are some of the general principle for the use of restraints. Again, we have to follow as nurses the two main ethical principles, that is non-maleficence and beneficence. So non-maleficence means you should not do any harm. So while applying this restraints, if it is going to harm the physical health of the child, we have to withdraw the application of the restraints. And the same way, other ethical principle is beneficence, that is when we are applying this restraints, if it is going to benefit the baby or the child in a very good way, we have to apply the restraints and continue our treatment, diagnostic modalities, and also all the therapies. So we have to follow the two main ethical principles of our nursing profession, that is non-maleficence and beneficence. And also we have to ensure that the restraints which is being applied is not very tight, that is going to interrupt the normal functioning and normal alignment of the child, and also the basic function of the child should not be disturbed due to the application of these restraints. So we will be seeing about each and every restraints in detail in forthcoming slides. So when should be restraints used in child? The restraint should be used only when it is absolutely necessary. The nurse should give the child a choice between trying to be still when asked for or to be restrained. If the child fails to keep himself to keep still, then restraints may be used with a proper explanation about its purpose depending on the level of understanding of the child. So restraint should be removed as early as possible. So for example, if we are being applying this restraints for the examination purposes, after the examination is being over, immediately we have to remove those restraints. And the same way, if the restraint is being applied for any therapeutic purposes, after the therapeutic or any therapies, we have to remove those restraints as early as possible. So this is all the time when we have to apply the restraints to the child, and after completion of all these procedures, immediately we have to remove it and do the proper documentation. That is, before application of restraints we have to do documentation, and also after the removal of the restraints we have to do the documentation by assessing their skin condition. We have to apply the restraints based on their conditions. Types of restraints are commonly used restraints for the children are mummy restraints, elbow restraints, extremity restraints, jacket restraints, finger restraints, and crib top restraints. So these are the some of the different types of restraints being discussed in this slide. So we will be seeing about each and every restraints, their purposes, and how the restraint is being applied. So we will see first mummy restraint. It is a short type of restraints used in infants and small children during the examination and treatment of head and neck. During examination of the head or the neck, we can apply this mummy restraint in order to prevent the movement of the extremities. So when the baby is moving their extremities, it is very difficult for the healthcare personnel to do the examination of the head and neck. So for in head and neck, what and all we will assess is like suture, fontanelles, and head circumference, etc. So mummy restraint is used to immobilize the arms, legs of the child for a short period of time. The mummy restraints involves securing a sheet or blanket around the child's body in such a way the arms are held to the side and leg movements are restricted. So during the examination point of view, we can immobilize these extremities in order to do the examination of the head and neck. So mainly we will be seeing the examination of the fontanelles, either the fusion of fontanelles has taken place, the anterior fontanelles and posterior fontanelles, the head circumferences. So what is the normal head circumference of the child during the birth, and is there any lesions or scars on the head, and we will also assess for any facial features like nose, eyes, mouth and throat, everything will be assessed. Next is elbow restraint. So elbow restraint is used to prevent the flexion of the elbow in an extended position so that the infant cannot reach the face. For example, the baby has underwent any surgical interventions. In case of cleft lip and cleft palate, the baby would have underwent the investigations in the lips, that is zitplasty, that is tennyson randall triangular flap. In that surgical procedures, if we have to prevent the babies being touching their mouth, and also in some of the feeding techniques also we have to prevent the babies touching their mouth with their extremities. So in order to prevent that, we are applying the elbow restraints. So and also that we are going to restrict the movement of the elbow. For example, I have said, like in surgery, in surgical interventions in cleft lip and palate, in nasogastric tube feeding, or the babies has been in a life-saving situations, those life-saving tubes, if it is being removed by the babies, it will cause a complicated situation in the babies. In order to prevent that, we are applying this elbow restraints. So we will see why this elbow restraint is applied for which purposes. Like elbow restraint is especially useful for infant receiving scalp vein infusion, nasogastric tube feeding, surgery of face or head, repair of cleft lip or cleft palate. So during the surgery of cleft lip and cleft palate, we will be applying one other restraint, is Logan's bow. So in order to prevent the babies touching that Logan's bow also, we can apply the restraint. One is being applied on the mouth, that is Logan's bow. Another restraint is elbow restraint, that is preventing the touching of the extremities to the mouth or the face. Next is knee restraint. The purpose of elbow and knee restraint is to prevent the flexion of the elbow and knee joints. These type of restraints can be made by making the pockets or slots on a piece of cloth into which the tongue blades will fit into. These restraints are then wrapped around the elbow or knee joints and tied at the ends. Next is extremity restraints. The extremity restraints may be used to restrain infants and young children for the procedures such as IV therapies and urine collections. So extremity restraint is also used to immobilize one or more extremities. So this extremity restraint is being used for either upper extremities or lower extremities. So if we want to do any blood sample collections or blood investigations, we can apply these restraint on the upper extremity to prevent the movement of the hands. And the same way, if you want to collect the urine specimens, you can tie those restraints to the lower extremities. Next is claw hitch restraint. A claw hitch restraint is a type of extremity restraint which is done with a gauze bandage strip 2-inch wide, making figure of 8. The end of the gauze to be tied to the frame of crib. The restraint should be used with padding to wrist or ankle. So before applying this claw hitch restraints, we as a nurses must ensure that the pads has been used during the application of this claw hitch restraint in order to prevent the skin irritation and skin lacerations. Next is abdominal restraint. Abdominal restraint helps to hold the infant in supine positions on bed. It should be applied with precaution so that the respiratory movement of the abdomen are not inhibited. So we must ensure that the application of these abdominal restraint is not going to interrupt the respiratory movement of the abdomen. That is the abdominal restraint. Next is jacket restraint. Jacket restraint is used to help the child remain flat in a position or to prevent the child from falling from crib, high chair or wheelchair. So it is like a jacket. The babies will be wearing this jacket, and we will be applying this restraint while sitting on the high chair or wheelchair or in the crib. So in order to prevent the falling of the babies from this high chair or wheelchair or from the bed, so that is a jacket restraint. So like wearing the jackets the baby will be wearing, and the long straps will be attached to the crib. If the baby is sitting on the crib means it is being attached to the crib. If a baby is sitting on the high chair means or wheelchair means it will be attached to the high chair or wheelchair. Next is anklets and wristlets. These are used to restrict the activity of limbs in a client who are potentially harmful to himself or others, to prevent the client from removing any appliances in treatment and to immobilize one or more limbs during procedure. So during any procedure or during any investigations like blood investigation or ABG analysis, or during the patient is very aggressive, so in order to immobilize this either extremities, we are using this anklets and wristlets restraints to restrict the activity of the limbs. So example, in case of violent behavior of patients in hospital, the wrist of ankle restraint is padded to prevent the injury to the soft tissues of the restrained limbs. Next we are going to see the finger mitten or finger restraint. So we have applied the restraints for the extremities. Now it is being applied for the fingers in order to prevent the movement of those fingers. So glove finger hand protectors, so prevent the scratching. So in order to, if the baby is having itching over the face during the after the surgical intervention, so during the post operative period we have to prevent the babies being itching. Next is crib top restraints. The crib top or crib net restraint is used to prevent the children climbing over the side of the crib. So if a baby is being standing on the crib, we have to prevent being that means climbing over the crib. So that is known as crib net restraint. It should be fixed to the cot frame so that the side rails can be lowered when necessary without removing the net. When the side rails are up, the child can stand at the crib but cannot climb over the side rails. So this is the crib net restraint. Next is the vest and waist restraint. The vest restraint means it is necessary while a patient is sitting in a wheelchair. Provide for as much possible at movement as possible. For example, if a patient is being sitting on the wheelchair, the movement will be there only to prevent the falling from the wheelchair. We are applying this vest restraint. Next is the waist restraint. It protects the client from falling out of bed but still allows the patient to change the position independently. So we will be seeing the image of both vest restraint and waist restraint. So vest restraint is to prevent the falling from the wheelchair. The waist restraint is it will provide a movement in the bed, but it is also like preventing the fall from the bed. So this is the two kind of restraint. That is, on the left side the person who is sitting on the wheelchair is vest restraint, on the right it is waist restraint. Next is safety belt. Safety belt are made up of electrically non-conductive materials. These are frequently used on stretchers and operation tables in order to prevent the client from falling. The belt which goes around the client's waist is attached to a long belt which is then tied to the bed frame under the mattress. So splints, plaster casts, sandbags, bandages, binders, slings and etc. are used to restrict the movement of different parts of the body. So other than these all restraints, the splints, plaster of cast, sandbags are also being used for the restriction of the movement. Next is environmental controls, like we are going to apply the side rails. So these are attached to both sides of the bed to prevent the client from getting out to falling out of the bed. So side rail must be kept raised on beds of all the clients who have altered level of consciousness, the elderly, debilitated clients and the children. That is, especially for the vulnerable populations, we are going to apply this side rails in order to prevent the falls from the bed. So far we have discussed about the restraints in children. So we have different kinds of restraints like mummy restraints, extremity restraints, finger restraints, claw hitch restraints, waist restraints, vest restraints. So we have different kinds of restraints. So why we have to apply restraints, and one more thing is like we have to follow the general principles while applying the restraints. That is, the restraint which is being applied to the baby should not be too tight and it should not be too loose, and it should not interrupt the normal functioning of the baby. And also while applying the restraints, it should not alter the normal stable vital signs. And in the same way, we have to ensure that while applying the restraints, it should not harm the baby. That is, we have to follow the ethical principles of non-maleficence, that is, doing no harm. Another ethical principle is beneficence. Whatever we are doing on the child population, it should benefit the babies. That is the restraint. And also while applying the restraint, we have to ensure that the skin conditions, we have to assess the skin site of where the restraint is being applied. For example, we have to check the restraints for about 15 to 30 minutes for till 2 hours. And also once the examination is over, once the purpose of that application of restraint is over, we have to remove the restraint as early as possible, and proper informed consent should be obtained from the caregivers, and also accent should be obtained from the child before application of the restraints. And also the restraint should be applied in such a way that if we want to shift the patient from one ward to other, or immediately we have to shift the patient to other places, it should be easily removable. So that's all about the restraints. If you have any doubt, kindly drop down in the comment box. Thank you for watching, and kindly subscribe and follow it.